What is the best weight for cosmetic body contouring surgery? My answer is always the 4 S's, and every patient should answer these questions before they undergo cosmetic surgery. What are they? Number 1, safety. Safety is important for cosmetic elective surgery. We want to minimize risks as best we can to get the best cosmetic outcome. Safety is really the only S where I can give a patient feedback. In general, for breast surgery, you're looking at a body mass index below 30. For body contouring surgery, it's a little bit questionable between body mass index of 30 to 35, but generally accepted that a body mass index over 35 does come with additional risks. Now, the first S, safety, does not actually relate to the quality of the cosmetic result. It's really just a question of risk to reward, right? How much risk you're willing to accept to get the surgery performed. 2, satisfied. So is a patient satisfied with their current weight? This is really important because we want to make sure the patient is happy with where their weight is, and they're not going to want to then tinker with their weight after surgery, either gain weight or lose weight after surgery, which might compromise their result. How could that compromise their result? Well, for body contouring surgery, if we gain weight, that might compromise the way it looks. For breast surgery, we'd like to avoid significant weight loss, and this is because it may deflate the breasts and cause some droopiness that wasn't there before. 3, stable. So this is the one everyone kind of knows already, but what does it really mean to be stable? I have a kind of a loose definition myself. So for most women, if their weight is within about a 5-pound window for the span of at least 6 months, that's essentially stable weight. For the average male patient, that window may be more like 10 pounds, but again, for at least 6 months. And that means the weight's not going to change dramatically before or after surgery. And that will increase the chances that we're going to have a long-lasting quality cosmetic result. 4, sustainable. Now this is kind of the forgotten piece of the puzzle for most patients, and it's linked to stable, right? So what I like to think about for sustainable is this is whatever we're doing to keep our weight stable, and that's diet, exercise, medications. Well, sustainable means we're going to plan to continue to do those things for the next 5 to 10 years, right? And that will make sure that we have long-term stability for our weight. Well, why is that important? Well, there are certain times when a patient considers dieting down before their cosmetic surgery, right? So they're doing things that they can't sustain, like exercising too much, going on very restrictive diets that they can't sustain, or taking medications that they're not supposed to take for more than months or a year or something like that. Then at that point, they may have a dramatic change in their weight and compromise their result. So those are the 4 S's, and everyone should be able to answer those yes, 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 and they will know that they're ready for their cosmetic surgery and get the best outcome possible. And as always, we have a couple of caveats here. So number 1, this is just generalized information. It's not meant for personal medical advice. 2, when we're talking about weight in this context, we're really referring to body composition, and specifically the fatty component of our body composition. Personally, I think if we could somehow talk in body composition for most patients, that would be ideal, but most people don't have a way to assess their body composition over time that's reliable. 3, I also mentioned body mass index, or BMI. And this term has come under fire recently for good reasons and for bad reasons. So again, this is just one way of talking about our weight and obliquely referring to body composition. It's not great for everybody, right? So when I talk about body mass index in this context, I mean a body mass index where the body composition is skewed too far towards the fatty components. Patients who may have a high BMI where this is not the case is clearly a bodybuilder, right? So their overall weight is high, but the composition is mostly muscle, and so it skews that body mass index scale. So obviously this discussion is kind of steered more towards patients who have maybe a little bit too much fat as far as their body composition, and that's what I'm referring to when I discuss body mass index. Are you ready for your cosmetic body contouring surgery? Then give us a call or visit our webpage, alamoplasticsurgery.com. You can visit us on social media at Alamo Plastic Surgery on Instagram or Facebook. We'd be happy to meet you and help you achieve your goals.